How do you fix a loose implant crown? What's the cause of the looseness? Is it the implant or the crown? 99% of the time, it's the screw retaining the implant abutment and crown if it's a screw retained crown. And here's how you fix it. This woman had a loose crown on this implant. And so it's a screw retained implant abutment. This the abutment, this the crown. This whole thing is loose because of a screw that goes through the crown, through the abutment, into the implant. That's why the abutment and crown are mobile, because the screw's loose. This is before and after. Now, an oral surgeon had placed this implant and another dentist had placed the crown and the abutment. So if you have a screw retained implant abutment and crown, you have a screw hole in the crown and abutment that screws into the implant. I'm removing the composite filling in the hole after you have screwed in the crown and the abutment. So it's a three-part thing. You've got the implant that's in the bone, you've got the abutment that the crown fits on, and then you've got the crown on the abutment. The actual abutment goes into the crown, and the screw goes through the crown and through the abutment, and it screws into a threaded part in the implant. So this is either a cotton ball or plumber's tape that's in the implant crown, because you always put something over the screw in the crown so that the composite and the adhesive doesn't get into the screw, just in case you ever had to remove the implant abutment and crown. So I'm removing that, and this is plumber's tape. That's the normal thing you put into the hole after you screw the screw in. And so this crown is mobile, so it's not a problem removing the screw because it's loose. So I'm removing some more of the plumber's tape that's in the hole. So the way this works, you've got the crown and abutment screwed into the implant, then you put plumber's tape over the screw, then you put composite on top of the plumber's tape. So I remove the composite with the drill, with the burr. Now I'm removing the plumber's tape, and that will expose the screw, and there's the screw. So this is a wrench, and it's not going to be hard to unscrew the screw. It sounds funny. It's not going to be hard to unscrew the screw, because that's why the crown and abutment are loose if it is a screw retained implant, crown and abutment. I use a screw retained implant, crown and abutment 99.9% of the time. It's a much better restoration, in my opinion, than a cemented crown, because you don't have to worry about the excess cement around the abutment or on the margin of the crown, which can be a cause of implant failure. So I'm unscrewing the screw. Remember, anytime you're unscrewing anything, it's lefty, loosey, righty, tighty. So if you're screwing an implant abutment and crown in, you go to the right, righty, tighty. So I'm unscrewing it, so it's going to be lefty, loosey. And this implant abutment and crown come out. You can see the screw here. Then I'm pushing that screw. It has to come through the top. Now, then I'm going to clean it with isopropyl alcohol. Then here's the new screw that I'm placing in the crown. So I've cleaned that with alcohol. Then here's the new screw I'm placing in the crown. Now you have to be sure the head of the screw is the right size. If the head is too large, it may not fit through the screw hole part in the crown. There are different sizes of heads. See, this part varies in size, so if it's too big, it may not fit in the screw hole in the crown. So you can hollow out that screw hole in the crown if you need to. It's easier if you just get a head that's the correct size. If I'm not using a seating guide, which you can watch my video on how to make a very simple seating guide from polyvinyl siloxane fast set occlusion registration paste. But if I'm not, I put a dot on the direct facial of the crown just to stay oriented. It's more interesting than you think, keeping that crown oriented when you're cementing it if you don't have a seating guide. So watch the video on this seating guide if you've got a model onto which to make the seating guide, because it makes it very precise and a lot easier. So I'm putting the screw in the crown, having the screw poke through the end of the abutment. See, here's the abutment, there's the crown. I want the screw to poke through, and then I'm going to put this Nobil grip on the screw. And here's the implant, orient the crown, and this dot on the side, if you don't have a seating guide, is more valuable than you think it is because it's easy to get disoriented. So I'm going to hand tighten it righty-tighty until it's stable. Then I'm going to come back with the torque wrench and I'm going to torque it to 35 Newton centimeters. So the ingredients of this are, we've got the new screw, we've got the Nobil grip on the threads of the screw, and now we're torquing it to 35 Newton centimeters. Once I've torqued it the first time, I'm going to leave it, just let it sit, go check a hygiene patient or something for at least 15 minutes, and then I'm going to come back and torque it again. I got this from a study that I read, and since I've been doing this, I've not had any loose implant abutment and crown screws in several years, and I'd had a few before that. So now I'm torquing it again, righty-tighty, the 35 Newton centimeters. There's the screw. Then I'm going to roll plumber's tape like a hot dog and stick it in the hole, and then compress it with a small amalgam plugger. And this blocks the screw from the composite adhesive and the filled resin. So you don't want that to get on the screw, just in case you ever had to remove the implant abutment and crown for whatever reason. Then I'm going to place primer adhesive in the hole and blow that dry and then cure it for about 4 seconds. Then place flowable composite in that orifice. Cure that. Be sure the patient has a Nightguard, because generally the reason they develop a loose screw from an implant abutment crown is from bruxism or clenching during the day. So that micro trauma just loosens that screw. So be sure they have a Nightguard so they're not bruxing tooth on tooth at night. I'm going to check the occlusion. I want to be sure that the implant abutment and crown is not contacting in eccentric contact. I want the primary occlusion to be on the mesial of the first molar through the cuspid. You can watch my video on occlusion. I definitely don't want the patient to be contacting prematurely on that implant crown. And check the side-to-side movements, the eccentric movements, because that can be a cause of a screw loosening with implant abutments and crowns. So I'm going to adjust the working side and balancing side contact so we don't have any on the molar. Then once I've adjusted those, I'm going to come back with a Shofu rubber wheel and polish everything. This is before and after. It doesn't look that different, but this is the composite in the hole in the top of the crown. So this is before and after. You can see how it's loose here and tight here. Be sure the patient has a Nightguard, and that tell them as they go through the day, hum. That puts the lips together and the teeth apart. The only time the teeth should touch is when they swallow. The teeth shouldn't touch when they chew their food, and as they go through the day, the teeth shouldn't touch. So that's the Dental Minute. These techniques work, and they work every time.
Are you ready to take your dentistry practice to the highest level possible? Of course you are. Subscribe right now to dentistrymasterclasses.com, where you will get Dr. Cutbirth's greatest work and best cases. Here's what you're going to get when you subscribe to dentistrymasterclasses.com. Incredible comprehensive cases not seen in Dental Minute videos. You will get an organized library of all the Dental Minute videos and Dentistry Masterclasses, comprehensive cases for study and reference, before and after photos of Dr. Cutbirth's fantastic restored cases. And all of this, I repeat, all of this is just $40 a month. This is something you cannot pass up. Subscribe right now to dentistrymasterclasses.com.